Carcinoma of Cervix. It is cancer tissue affected lower part of uterus in cervix. Abdominal growth of cell which having ability to invade or spread to other part of body. Cause infection with human papillomavirus HPV. It is cause of around 90% of all the patient cancer of cervix. Multiple sexual partner. More number of pregnancies. Long-term use of contraceptive pill. Chronic smoking. Pathogenesis. Grossi, the invasive cervical carcinoma may present following type of pattern. Fungating. Ulcerating. Infiltrating. IGO clinical staging of CA cervix. Stage 0. Carcinoma in situ. Stage 1A. Preclinical carcinoma. Diagnosis only by the microscopic. Stage 1B. Clinical lesion limited to cervix more than the size of stage IA. Stage 2A. No obvious parametrial involvement. Stage 2B. Obvious paramental involvement. Stage 3A. No extension to the pelvic wall. Stage 3B. Extension to the pelvic wall which are without extension up to kidney. Stage 4A. Spreading of cancerous metastatic growth to. Stage 4B. Spread of this cancerous metastatic growth to the distant organ. Characteristically, the cervical carcinoma arises from the squamous columnar junction. The advanced stage of the disease is characterized by widespread destruction and infiltration into the adjacent structure like urinary bladder, urethra, vagina, regional lymph node, etc. Distant metastasis may occur due to lung, liver, bone marrow, kidney, etc. Histological. Around 70% of the cases involve squamous cell carcinoma. It shows common pattern of interstitial epidermal cell. Adenocarcinoma compose about 20-25% case of carcinoma in cervix. It is usually show well differentiation mucous secreting adenocarcinoma cell. Clinical feature: increased vaginal discharge, bleeding occurring in between the regular menstrual cycle, heavy menstruation bleed, pelvic pain, weight loss. Diagnosis: pap smear test, cervical biopsy, colposcopy, CT scan or more MRI to known as spreading of carcinous growth. Treatment: chemotherapy, which may include the medication to destroy the cancer cell, example cisplatin. Radiotherapy, where with the use of radiation the DNA structure increase the tumor cell can be damaged and therefore this destroy their ability to multiply. Surgical management mainly include the hysterectomy.